Bismillahirrahmanirrahim. This is the case OSCE number 3. And as we see here in this CT scan, what do you think the procedure is? The procedure is CT angiogram of the aorta, CT angiography of the aorta. Let us move to the first question. What is your diagnosis? As we see here in this CT angiogram of the aorta, this is the pulmonary artery, right and left, and this is the descending aorta, and this is the ascending aorta. The ascending aorta is dilated, and we have intimal flap, as we see here, loose hypodense area, and we have two lumen. One lumen is larger than the other, and one lumen is denser than the other. And we have Belfer calcification here. So we have, this is the true lumen, and this is the false lumen. As we see here also dilatation of the ascending aorta. Normally we accept up to 3.5 centimeter, and here it is more than 3.5 centimeter. What is the classification of the disease? We have two classification. As we know, we have the Stanford classification, and we have the DeBakey classification. And please go and read what is the difference between Stanford and DeBakey classification. What are the complications of this disease? Complications are maybe due to from the aortic dissection, due to death, due to severe internal bleeding, and we have organ damage like kidney failure and life-threatening of the intestinal damage, and we have stroke, and we have aortic valve damage leading to aortic regurgitation or aortic rupture and cardiac tamponade. What are the predisposing factors for the disease? We have multiple predisposing factors, and I will mention some of them, and please go and read the whole list of the predisposing factor. We have patient with high blood pressure uncontrolled, patient with atherosclerosis, patient with aortic aneurysm, patient have bypassed aortic valve, and patient with aortic coarctation, coarctation, and certain congenital genetic disease like patient with Turner syndrome and Marfan syndrome, and other connective tissue disease like Ehlers-Danlos syndrome and other diseases. What is the treatment of choice in this patient? The treatment of choice in this patient is urgent surgical intervention because we have type A and type A dissection, and the descending aorta is not involved in this patient, and we need to inform the surgeon immediately what are the findings. So we have in this patient, we have aortic dissection involving the ascending aorta type A, and we have intimal flap, we have two lumen, false lumen, as we see here, with less density of contrast, and true lumen with high density of contrast and dilatation of the ascending aorta. Descending aorta is not involved. And the treatment, it is surgical, and we mentioned the classification of the disease, Stanford and the Baker classification, and you read the what is the difference between the two classification. In general, we have type 1 Stanford classification, type 1 and type 2, it is involving the called type A, and type 1 involving the ascending aorta and descending aorta, and type 2, it is involving the ascending aorta alone without descending aorta, and we have type 3 involving the descending aorta distal to the subclavian artery. And in the Baker classification, we have type 1, it is involving the ascending descending aorta, and it is account about 60%. Involving the ascending aorta alone, it is about 10 to 15%. And this is type 2. And DBK type 3, involving the descending aorta uh, distal to the subclavian. And this is DBK type 3, and it is also called the Stanford uh, type B. Stand for type A, DBK type 1 and DBK type 2, as we mentioned. Thank you for listening and hoping to see you soon in another talk. سبحانك اللهم وبحمدك أستغفرك وأتوب إليك.